the station that's on your side. This is Channel 7 News Daybreak.
Heart disease and strokes are still the #1 cause of death in Arkansas and the United States. Every year, the American Heart Association releases a list of major advances in heart disease and stroke science. Here to explain some of the latest, Baptist Health cardiologist Dr. Anthony Fletcher. Dr. Fletcher, good morning to you. Happy New Year. Welcome back to the studio.
Good morning.
Hope you had a great break.
Had a tremendous break.
Okay, so let's go over some of these advancements. We've got quite a few things to get through today. First, tell me about why we're talking about lowering blood pressure through churches and barbershops. What does that have to do with heart?
Well, you know, it's interesting. These new guidelines essentially talk about ways that we can affect overall survival.
Okay.
And blood pressure has emerged as one of the major things. So we looked at the disparities in blood pressure, and unfortunately there is a higher incidence of hypertension in the Afro-American population and Hispanic population compared to the Caucasian population. So one of the ways that we looked at was looking at the churches, because that's a place where a lot of Afro-Americans and Hispanics congregate. And so they looked at people with intensive sessions on education about blood pressure, in addition to their faith-based exposures. And they had some one-on-one sessions with that. And they looked at that group over a series of years and found that there was a lower incidence of hypertension and better controlled hypertension in those control groups that were looked at in that faith-based community.
Okay.
In addition to that, they also looked at barbershops, which is another area where sometimes men are more frequently to go that don't go to church-based facilities. And they looked at them with one-on-one intensity. They trained their barbers to talk about blood pressure and encouraged them to go see their physicians. And then in addition, another subgroup of that had pharmacists come in. And those pharmacists also worked with the potential clients and worked with those blood pressures, and they saw a significant drop in blood pressure and better control.
Wow.
So that was verified by scientific data.
All right, cholesterol control to combat future heart risk. What does that mean?
Well, basically, we know that in the past, cholesterol is very important in terms of your risk for heart disease, mainly heart attacks and strokes. And so we've gotten more aggressive about lowering that level, the LDL levels, you know, less than 100, down to 70 and better. And so we now know that an aggressive management with moderate to intense dose statins is important to getting there. And then in addition to that, those people who don't reach goal, we've talked about the PCSK9 inhibitors added on top of the statins to get that down. And the data now shows us that we reduce the incidence of myocardial infarction and stroke.
Wow. And you have one more thing?
One more thing I was going to add to that is the triglycerides. You know, it's been kind of up and down in the data as to how you handle triglycerides. The data also shows now that even though you've reached goal with your LDL cholesterol, aggressively treating the triglycerides to goal is very important and shows a marked significant decrease in the incidence of death, myocardial infarction, and stroke in that group that you also control the triglycerides.
All right, Dr. Fletcher, thank you so much for coming in this morning. Appreciate it. And always staying up to the latest at Baptist Health. And that's why if you have any issues, call them at the number on your screen or go to baptist-health.com for more resources that they've got on their website.